No way. That is cool. You're like, we can get together.
Well, actually,
Yeah.
we're all having to do these interview things.
Oh yeah.
So he reached
our joint power agreement with one another. Since we first started that conversation to now, Tri-City is voting to move operation of the hospital under Sharp Healthcare, right? It looks like Sharp, that will pass. The community has done 4 or 5 meetings, community meetings, and so far it's all been very positive. So probably within the next, I think 6 months, I think they were saying a June election. The June election, that will go special election to the community, they'll vote for it, then that transition will happen. The reason that that is relevant is that our partnership with Tri-City to do these clinical services is now going to shift, right? If Sharp is part of that conversation, our conversation will probably change. So we're exploring what that will look like. So we don't really have anything to bring forward at this time. We may create an ad hoc committee of the board to investigate, see what that's going to be.
Yeah.
So just know that we are continuing to look at that. We know clinical services has been, the #1 hit list.
Yeah.
Everybody wants it. We want it. We want access to care for our community. So we'll continue to pursue that. But obviously the shift with Tri-City to Sharp makes a big change. And we want to make sure that we're keeping those conversations going.
Yeah.
Sharp is a big player. It might be nice to be able to have a bigger player in town.
That'd be nice.
It would be nice. Yeah. It could be really beneficial.
I mean, even if nothing is technically happening right now, it's nice to know that. I mean, people aren't here, but
right.
We were still talking about it and it's relevant.
Yes. Yes. And what's nice is that Sharp is able to bring resources above and beyond just what Tri-City could do. The Tri-City partnership together only strengthens resources for North County. So it's exciting. So we'll keep you guys updated as that moves forward. The CRM software. So that's our client relationship, customer relationship management software. The reason that's on there for this committee is that Chair Jeffries has, since we started programming a couple of years at the Wellness Center, has really wanted to make sure that the district has a mechanism to track not just the number of visits that people make to the Wellness Center, which is great. Teresa and her team keeps track of attendance, but to begin to identify who is coming and what are they coming for. And that level of detail is impossible to track right now. Teresa and her team are doing a great job from the attendance, and then they go into constant contact or a little email marketing, and they put a little tag that says this person likes chair yoga and this person likes Tai Chi. But it doesn't really say they come to the spinning classes, or as we move class times around, attendance moved. So we've really been, and by we, I mean mostly Teresa, we talked to a couple of different software platforms to try to figure out what fits. We have a software right now called Event Temple that their team uses to really organize and schedule. And it's basically allows Bianca primarily to say, okay, room B3 is full from 2 to 4, B1 is open from 11 to 12, and manage all those rooms. As we finish out building A and the demonstration kitchen in that large room, that's 2 more large spaces. Eventually with the house. So they have gotten a really good handle of how that software works. I'm queuing this up if you want to talk about your follow-up conversation with HubSpot.
Yeah.
Without too many weeds.
Sounds good. So I have been in the weeds with all this, but we've been looking at the CRM to be HubSpot. And one of the nice things is it has a lot of email marketing functions, and it's built for marketing. So it'll help us to understand the people and stay in contact with them better. It has an event portion of it, so we should be able to track that attendance and a little bit of demographics about people. As we get that information, we'll have a place to keep it. So that will be really beneficial for running reports and understanding the use of the center in the future. Where the problem was with all this, with how do we get the booking software that's doing, like our calendaring, to talk to this CRM,
Mhm.
because this is a different use of calendar than a lot of the, integrations that work with a CRM system. So we did find a way to use Zapier and the two can talk to each other. So we think the problem is solved. Because otherwise, without some kind of integration, we would have to go in and take those 100 events that are happening in Event Temple and type them into whatever the CRM, whatever the other one is.
Oh, okay.
So that's a whole lot of double work, a whole lot of chances for mistakes. So finding a way for them to communicate, if we couldn't find an all-in-one, which it doesn't seem to, we haven't found that. Yeah, we've been looking for a while.
Yeah, and building proprietary software is always full of problems, because as soon as you build it, then you're reliant on whoever built it to run it forever.
Yeah, I
And
know.
yeah, it's expensive and it's rife for disaster.
Yeah.
So Teresa and I had a conversation about it today. Did she come back to you yet?
I haven't seen the pricing yet.
Okay.
So what came out of our conversation, so we've been doing a lot of discovery, like, is this really gonna work? Before we switch over to a new platform and do what we need it to do. And so part of that discovery came up that we would need to go to a higher level than we initially thought of the software in order to get that integration to be effective. But the other thing that higher level gives us would be, we could do sensitive data there, so it would be more HIPAA, it would make the option to make the parts of the platform HIPAA compliant.
Okay.
So that's a
Not that we're
benefit.
collecting
Not that we're,
medical
yeah, but
information.
still, you know,
But we might grow in the future, so we have to.
yeah.
Yeah, and there's sensitive information that they do already kind of collect through our partnership program for the diabetes program. And there may be other things. So having that protected health information be able to be blockaded off, that's a good potential option.
Yeah, so we're waiting to get the pricing to see, what does this jump mean? The Zapier integration part isn't that expensive per month. But yeah,
So because it has a potential big impact on budget, we're waiting to see what it's gonna look like. If it's a high enough priority for this committee and for finance to say, yes, you can go over your budget line item significantly. You can start it in January, or do we need to revisit it for next fiscal year in July? So that information, because it was requested from this committee, that's why that's on this agenda.
Oh, okay.
Does that make sense?
Yeah.
Okay. Again, I know lots of context. If it's too much, you can be like, yeah, I get it.
No, I understand.
Okay.
I work for software. So
Yeah.
I don't-
Yeah. Especially that custom made stuff.
Yeah, because we've had to switch stuff up twice already to new systems, so we have to like individually put stuff in there, and it's just a lot of work.
It's,
So I can understand.
Yeah. And the more people that touch it, the more error that gets
Yeah.
integrated. Yeah.
But do they provide like a training class?
they would have implementation specialists that helped us. And then I confirmed, so they would each help with their end of the integration. And then we have Jason, our IT support, and he can help with that too in the management of it, but that integration continues to, go smooth.
Okay.
So that's our CRM software.
D is our Q1 community health contract impact reports. And this is Raquel's first time to get to talk about
That's
those.
right, I'm supposed to talk about it.
Right?
Yeah, I was just gonna grab the sheet that I had handed that
For
she
Jennifer.
wanted, yeah,
Yeah.
that she wanted, so I can give that to you,
Okay.
so that you can check it out.
And it was in the packet.
It was.
But this is really the first time you've been through the grants at all.
Yeah.
So we'll talk more about this actually when we talk about our grant thing. But each quarter, the current grantees are supposed to provide us a report. And we historically have tried to standardize them as much as possible, which was difficult because boys and girls swimming, their numbers and reports don't necessarily match with the food pantry.
Yeah.
Right? They're totally different kinds of services. But one of the things we always ask for is give us a story about how it's affected. How did this grant funding make a difference in what you do? So I don't think we need to go through them all,
No,
but if
no.
you want to highlight or talk about whatever you want to talk.
Oh, well,
Hi, welcome to the deep end of the pool.
thank you so much.
You're
She
welcome.
just threw me in.
I told you we were gonna do this.
Well, we were just talking about how a lot of the times the reports that they send in, they have all of the data and the information we need, but the information is lacking. It's just numbers.
Yeah.
And I will get a nice touching story most of the time, but that's all we get. And so we were just been talking about how impactful are these reports. So I did a little breakdown on my view of it, and
Yeah.
I wanted to see what Rachel thought too, but she's like, nope, we're living it just like this. I was like, okay.
Because I've read these now for 6 years, and I wrote them for 4 years before that. So I feel I have some pretty significant bias on my input here.
Okay.
You know, I mean, when I wrote them from, you know, this side of the reporting. I'm gonna give you all the stories, but so I'll put myself in the nonprofit shoes. I may have 20 grants I get a year. And if I have to submit this report for $20,000, which is not a small amount, but if I'm receiving $1 million in grant money, $20,000 and the reporting requirement, gathering the numbers and putting that in there takes energy and time.
Yeah.
And then trying to come up with the story and the things, it ends up being less impactful because it's just a routine reporting
It
piece.
becomes tedious.
Right. So now I step back over here into this report and I try to encourage the grantees, like, you really gotta give us, but I understand both sides.
Yeah.
So that's where I'm like, it's good, it's bad, it's bad, it's good. And so someone who doesn't do this all the time was like, you give your report. And so she's seeing the same thing, which is there's not a lot of detail. It doesn't give a lot of really good meat or depth to it, because when the way our grant process is right now, it's very restrictive, right? I'm gonna give you this amount of money and you're gonna do these tasks, right? It's very transactional.
Yeah.
So if their world changes or their program is just moving along, they don't have a lot of meat. They're like, we're just doing what we do, what we said we'd do. It doesn't make for a compelling story because we're only seeing this tiny slice of their overall impact. And that will make more sense when we get to a different agenda item. But some of the reports.
Well, what I have found the last 3 years that I've been doing them and reading them, they're just reusing them. They're just basically reusing what they gave me last year and changing up a few words and it's, so they'll change up the little story or the pictures, you know, or the child, but it's basically the same thing. So it's been interesting, and I can understand, like I said in my notes, I can understand how it's difficult to report.
What are they given when you tell them that you want the report? Do they have like a template? Okay.
So we use JotForm as the platform that they submit on. And, you know, there's some standard box numbers they fill in, you know, how many participants, age groups, blah, blah, blah. And then it's basically just a large text box. Tell us how it went. Upload a photo. Give us examples of what you submitted. Right. Let's go back to your social media one. So like, this is the food pantry?
Food pantry.
Yeah. So this is a post that they made about getting the grant. Well, it's great.
I didn't do anything.
It's great.
Right.
It's great.
Yay. And here's a good example. It's really tough for the food pantry to tell us a client story because it's very personal. It's very sensitive.
Yeah.
Right? We know that. That's why we gave them the money. But for us to then be like, okay, give us stories. And they're like, oh, we're trying to feed people. It becomes a challenge.
Do they have a little box at their location going like, you would like to share how we've impacted you?
I don't think so. I don't know, honestly, how much feedback they'd get. I think they do some sort of satisfaction surveys from their own standpoint, like, you know, how can the food pantry help you? I'm not sure, like, they do give us this story.
This one we've gotten it's basically the same story, but with a different person, which is beautiful. We want that. We want them to be helped. We want them to be fed. But it's, again, like I said, repetitive.
Yeah. Okay. Are we looking into maybe updating that template?
The template won't make any difference, to be honest with you.
I can't see any way.
So, when we get to item F, I think that, that might, it's been an issue that we've been trying to solve for a while. So I think when we discuss that one, it may prompt the decision-making and problem solving you're trying to do right now.
Okay.
So, cause it's the same thing, it's like, is there a better way to ask the question? Is there a better way to get information?
When they submit it, do we give them feedback?
From this report, not really.
Okay.
Usually what we'll do is be like, can you give
I
us a
mean,
little?
Is it because they're doing the same thing, like you're saying over and over? It's like us when we report financials, you can only get so exciting with financials, you know?
Right,
Exactly.
I spent the same dollar amount on the credit card.
right,
This month on software.
right. We're still within budget. Nothing has changed.
This month is Adobe.
Right, let's talk about Event Temple, woo!
It's scary whenever you have fake news for financial.
Right,
Yeah.
right, either direction makes you go like,
It only comes up once a year. If you are gonna have something fun and exciting in financials, and you probably only want it to come up once a year. But if somebody were like, write me something exciting on financials, I'm like, oh my God, and like, what do you want me to say? It was really tough.
well, the checks went out one day later.
Yeah.
Reconciling them was really fun. This
But we lost a receipt. Sorry.
It was challenging every bit.
And here's a picture of us in the finance going,
So funny.
I mean,
That's, I think, sometimes what happens because they are doing so much work and actually putting their energy into what they're focused on. And this reporting is just reporting like to what us is like a financial data, like I need to report.
exactly. And because we're asking them currently to do it quarterly, it's just a task, right? It doesn't give us a picture at the end of the year of like, how did it go? And if this is just, if we only funded one of the 5 things that they're doing, we're not really seeing the full impact of what they did because we only gave them this and they do all that. So.
Made it.
Oh,
Case in point, they made it.
I don't know how I ended up with Annabelle's notebook, but I did.
Oh, you have her notebook?
Oh my gosh, sorry.
We haven't quite gotten to that part, but that'll make a good relevance. So, we were just talking about how the impact reports are kind of blah.
Yes, I saw blah.
Yeah.
Yeah, did you
I
see
wanted
the
to-
actual blah? I printed it out for you there.
Oh, thank you. Yes, I was curious as to if you would feel the same way.
Well, I have for the last 6 years.
I'm just
Yeah. And then I was just giving Cindy the context, you know, for the last 6 years I've been reading them. And for the 4 years before that, I wrote them.
Yeah, exactly.
So I'm biased. It's difficult for me because I understand both sides of the conversation. And I was just sharing that it's a very routine task. And the fact that we do it quarterly and we only do it for one teeny tiny thing.
Yeah.
Makes it less impactful because what they do is everything. But
Right.
we ask them to tell us one story about,
One mini story.
right?
Yeah,
So,
MINI.
yeah. So that's kind of,
I passed it. Yay! Sorry, I had to know.
that's right.
Good for you.
I was stressed.
Good for you.
For you.
What did you
She had
I had a
Accounting.
test, an accounting test.
Okay.
On Wednesday, which is why we had to change to Friday. I never gave context. More words. So would that be?
I think that's, Kat, does that make sense to you on,
That makes sense.
yeah. And so, and then I already shared, what we were planning to do with, community needs assessment, the point behind it. We talked about the fact that we are still investigating clinical services and the fact that Tri-City and Sharp are going to be doing this partnership, how that will generally affect us, but we don't know yet, and that we're still part of that conversation. Teresa talked about an update on the CRM software. We think we've found a solution, but we're waiting on some pricing and we're waiting on a few more things, but it would actually integrate that calendar scheduling function to our being able to keep track of some of those metrics that have been of interest, but we're waiting to see what's it gonna cost.
Gotcha.
And I think that brings you up to speed of where we are.
Thank you. I'm a speed listener.
You are. You are.
Okay.
So, and then we started to very quickly, because obviously Cindy's like, all right, let's go into problem solving. How can we fix this impact report in them all?
Yeah.
All right, before we go there, we're gonna talk a little bit about that in point F. So we'll hold that follow-up part of that conversation and we'll jump to E. Do you want to talk about your program development review process?
Okay, I thought that was next month, but yes.
Well, we're gonna present the whole thing, but you want to talk about
Okay, I thought like.
you
what
talk
was
about
in-
what you thought we thought we were gonna talk about.
Okay, I thought it was an update on what was in the works.
Could be.
Okay.
It is today.
It is today. All right.
That's
So-
on the menu.
Good pivot,
So
that's the way to
okay,
pivot.
I thought it was more like an update on where we are, so I was gonna just share a little bit about kind of some of the big pieces of programming we're working on. One of the new initiatives that we're just getting started with is with the Fallbrook School of the Arts to do an art therapy program. So that would be for, so that's in the works, still being developed, exactly what that would look like. We have the other big pieces kind of all tie into our lifestyle programs. So continuing with that theme, how do we empower people to take charge of their own health? And so one of those is a mindfulness program that's going to focus on stress reduction, and the evidence is out there how much it benefits overall health. So it ties into lowering blood pressure, it ties into, controlling your diabetes, as well as reducing stress and anxiety and depression. So that is going to be coming up at the beginning of the year. And we're really excited because we have a great instructor who is bilingual. So this program will be available in Spanish and English.
Yay.
So yeah, and she's really great. She can do programs geared towards families too. So we have a lot of range with what she's able to
Oh,
provide.
that's great. Family would be great.
Yeah.
So, frequency and time.
So the program as we've outlined is we'll have some we're going to make it very accessible to people. So we're going to have like some Saturday workshops during the year, and then also some 4-part series. And then that will roll into a once a month mindfulness like drop-in session. So you can work on your skills, learn some new ones. So regardless of whether you have a Tuesday night to devote to it or a Saturday morning, you have a couple of access points into the program. And so this instructor is trained in NBSR. So it will be, going with the principles of the mindfulness-based stress reduction program. So, and we've done a trial with her at the center. She's done a class before. It was very well received. Great reviews on the surveys. So
MBSR, mindfulness-based stress reduction. And it's a certificate program from UCSD.
she is.
They get the accreditation. That's beautiful. I'm so glad.
Yeah, she has the accreditation in Spanish as well, too, which is a whole nother process. So yeah, so we're really excited about her. So we're finalizing that. The other thing we're working on is a heart health program, which is going to target hypertension. And so that came from our Catalyst report. It also is a lot of feedback from different survey results we've gotten, like from Vista Community Clinic on what the Spanish speaking community needs, and from our own Catalyst information. So we're looking at a couple of different curriculums to decide on what's going to be best. We're sticking with, like community-based type programming. One is one that the YMCA uses that we're looking at. Another one is American Heart Association, maybe the DASH. So putting those components together, for the program, because we don't have that clinical component. That community ones are really great, but they're all evidence-based programs that have been proven to reduce, blood pressure. So a nice thing that just kind of happened to come up along with that is a program with the American Heart Association we're going to be doing. the title doesn't really fit us because it's called Libraries with a Heart and we're not a library. But the library in Fallbrook, the County of San Diego isn't participating in this program. So it opened it for us. Grossmont does it as well at their library, where we're going to be able to check out blood pressure monitors to the
Oh,
community.
nice.
So it just ties in
Beautiful.
beautifully, really great.
Your library adjacent.
We are.
Right.
Yeah. Yeah, close enough. Yeah, so we'll have a monitoring station, that will be in our welcome center, so anybody in the community can come in and monitor their blood pressure, and then we have kits, to send out with people with full instructions, how to do it. They're supplying all the information and the kits, and along with that agreement comes, some CPR, support, so they're gonna be giving us a training, I keep saying dummy, it's mannequin, a training mannequin and some other supplies. So we're gonna be able to expand our Wellness Wednesdays, where you'll be able to go through one of the stations and practice hands-only CPR. So
Nice.
I think that'll be a great, so that's gonna be a great partnership, a nice addition to our CPR program that we currently have. So the other big piece that we're looking at is nutrition. And so that was, finding, the right partner. So it looks, we have, we're in talks with, it's called Leah's Pantry, and they have the evidence-based curriculum that Cal Fresh was using. So the stuff that was just cut. So, but all the programs exist. They're tried and true. So there's a couple of programs that they have that we're going to be able to bring over to the center. So one is called Around the Table, and it's more of a cohort focused, and you kind of go a little bit deeper, learning about nutrition in your life. And the other one's called Food Smarts, and it can be done as a program or broken up. So we're deciding how to implement that throughout the year. But both of them have the component of education, kind of making changes, and then a food demonstration of some kind. You're going to make some kind of little snack, something to share with the group. So they'll have that demonstration as part of that. So the other thing that they have with their curriculum that ties in nicely what we're doing is they have an add-on that can be used with those nutrition classes called Body Connection. So they talk about movement. So it's really a nice, fits in really great to have that, eat right and, move a little more. So that is all.
That's
in the
big for
works.
2026.
Yeah.
Yeah.
Yeah, it's just a couple of things.
There's
Yeah.
a couple of things.
Yeah, so a lot of these things have been in the background we've
Yeah.
been working on.
Yeah, they're
But,
coming
yeah.
into focus now.
Yeah, it's taken a lot of like, who is this partner? Are you gonna charge me an arm and, like, is it just astronomical? Is it something that fits in? Is it the right type of program? So, some smaller, like partner-based, updates are, we do have the county MOU in place. That is finalized, so that makes it a lot easier to get some of the program we've already had, like the Tai Chi classes. We're gonna be doing Tai Chi for arthritis, as well as a lot of other things, some elder abuse awareness, some dementia support.
Things that the county supplies.
Yes,
Beautiful.
yep. So that's all, just part of that agreement with them. It makes it a lot easier for us to
Right,
work together.
access it.
Yeah.
And, we're fond of being up here in the north, feeling shortchanged by county services. So this is a good thing.
Yeah.
And one of the things we found early on was a lot of these groups that were funded by the county, they just didn't come up here because they didn't have a partner.
Yeah.
They didn't know where to
Yeah.
go.
Right.
Well, that has been really beneficial. I mean, mental health first aid was the first out the gate for that one. They were like, we're funded with, we don't have a North County partner. Yeah, you do.
Yeah.
And Teresa and Bianca have worked really hard to establish those relationships. And so now they see, we have a great space. We have a great outreach to the community for this. So it's really been able to build. And then Teresa has been honing in like, all right, specifically, what do you have? And she goes down a lot of rabbit holes on what the county offers.
A lot of rabbit holes. Trying to get to maybe who is their service provider?
Yeah.
We just work with them.
Mhm.
And so it's good things. We were hoping this will come through for next year, but we had a little program called Mobility Matters, which was, fall prevention. And that was very, very popular, very well attended. And so we're hoping to continue that that would be a once a month type thing throughout next year. And that's with our partner at West Pace, who we had all that time ago, all those pages.
Yeah.
So fantastic come out of it.
We went and visited, yeah.
Yeah, so Bianca did a great job of putting that together into a great program. We have 2 new support groups. So Michelle's Place is offering an all cancer support group that has come in demand. So they did a program. A lot of the community members came. We had about 15 people come and they asked for it. And Michelle's Place, has put that together. And so it just started just last week. So that's great. And then an Alzheimer's support group, which is another thing that has been really requested by the community. So for family programming, we're working on some workshops with focused on mental health with social media and youth and getting kids outside. So with a partner called Nature Unplugged. So hopefully that will come. That's still in development. And then Katia has received training on immigration safety planning through a group called URISE. And so that's something we're working on, how to work with the community to bring that, that information out.
I'm sure you're gonna be talking to voices.
Yeah.
On the many things having to do with lifestyle change, as we launch those, and there's several that you've mentioned today. I just want to put in a word again as we start them to do a plan for follow-up data. And here's why. I know they're all nationally known, and I'm glad we're doing evidence-based. That doesn't mean it works in every community. We can't assume, oh, that was the national outcome. That's going to be the outcome for us. I don't think we can depend on that. We need to know what it was for us. So whatever it can be to be a follow-up data over the years, really. Because if we're going to invest time and money, we have to be able to say it mattered. Not just now or 1 week after the program, but that there was a residual effect to whatever degree. 3 years out is fine. But as we start them, we need to have that in mind. So we have a research data gathering protocol and we're ready to do it. We're not doing a rear view mirror.
And that's a big part of the research we've been doing around the CRM.
Yeah.
To try to have a place where we can keep that
Yeah.
and be able to track who went, what's it look like, what's the results been.
How are they
So-
doing now? A year out, 2 years out, whatever. So I'm all for the validated ones. I'm glad we're going evidence-based, of course. But we can't assume that we have the same results, would be my caution.
We have plans in place for them as we're starting, like what data we're going to gather in surveys, but the longitudinal, the little bit out later, the CRM system will help with that because we'll be able to see who are all the people who did this in this year. And
Beautiful.
make it much
Efficiency.
easier.
There's an efficiency. You don't have index cards.
Right.
No index
Our
cards.
index cards.
No index cards.
No,
Or
what is
20
it?
Excel
No
spreadsheets.
wire hangers, no paper index cards.
No Excel spreadsheet, all 5,000 of them.
Yeah. Well, this is very exciting going into 2026. There's so much going on. And I will put in a thank you for the progress made on Spanish offerings, mirroring English offerings, and any way we can get this part going, whatever we're offering there. I don't know whether a volunteer partner from the community shadowing, I don't know how it could be done, but the more we build that capacity, the better.
And we do, so the nutrition, the mindfulness, and the heart health are all being set up in English and Spanish.
Beautiful. Happy, I'm happy.
Good. Any questions on that or?
Good job. Extend our thanks to the team.
I will, thank you.
So then we'll move to F, which is the new grant funding philosophy review. And this is more informational, but we do have a timing that goes with it, right? So currently our grant program, the grant application window opens in February. Then the board looks at it in March. We award in May so that I have time to budget it. The challenge in some respects we've already discussed that you talked about in the impact report, right?
Mhm.
We have this static template that all of our nonprofits try to fit into, even though their missions vary and what they do differs. So what I put in the packet is a white paper that takes from a number of different resources around something that's generally called trust-based grant making. And the point behind it really comes from this conversation of, we know who our grantees are, right? They're already trusted partners with us. We've looked at them in the community. We go to their things. We see them in action. If we were a major metropolitan area, this might be a little more different because we may not see all of those folks. But this movement has been growing in the nonprofit sector for the last 20 years. You've really seen this shift. And the core of it is currently we make what's called restricted funding. It's very transactional, right? I go to Jennifer and I say, I'm gonna give you $20,000 to
Do mindfulness.
do a
for
mindfulness
Special ed moms and
for
dads.
special ed moms and dads. And
They're on my mind.
right, perfect. And she goes, okay, that's one of my programs. I will take that, I put in this application, it's approved, I give you $20,000. And then she says, okay, that's one of the things I do. And then she reports on it, these static reports, and it's like, yeah, she's doing a good job. Okay, great. But what I don't see is the breadth of the things that she does. I don't see the additional support groups. I don't see the additional partners, because that's all part of what her agency does that I can't capture in the snapshot of this one tiny grant that's super restrictive, right? God forbid, pandemics hit, budget cuts hit, and being a nimble nonprofit, she says, I have to shift what I'm doing. And she comes to me in our transactional relationship and she says, please, sir, may I take my monies and do this instead because I can't do that. Now, as the funder, I can say, nope. Now, in this community, we're going to understand what the challenge was and say, that makes sense. Mm-hmm. But it puts us in charge and it gives us the power over her program. And it demonstrates a different trust level. What I'm proposing through this and what the industry is moving toward is making grants that are considered unrestricted. Now, the nonprofit still has to prove that they're in good standing. They still have to provide us financials. They still have to do those same things. Mm-hmm. But now their application is, hey, I'm Jennifer's family support agency, and we do this menu of services that supports this population this way. And I need $20,000 to support those programs. Mm-hmm. And that's where our conversation is. Wow, that's really important. We really like that. That fits with the district. And then the board says, yes, go forth, carry on. And at the end of the year, she'll give us one report that says, Jennifer's family support agency, I already forgot the name of your program. We did this for all of these folks. We did this for these folks. And she gives us this beautiful picture that is the kaleidoscope of her agency, mm-hmm. instead of this one snapshot that just showed the color blue, right? Mm-hmm. Moving to this model is more of a philosophical shift than anything else. We can change the district's process pretty easily. Again, we're lucky. We know who our grantees are. Mm-hmm. They're in this community. We're all going to the same things. We see the same things. If an agency isn't performing, it becomes obvious, especially to us who are touching and involved with the reports and things. To you all, as elected board members, you're in your community as well. So if you don't see them, you're gonna start to wonder why, right? This gives us more opportunity to be more partnership in our relationship with those grantees and less transactional in our partnership with them. So when it comes back down to how would we structure this? Here's the boring part. What's your 990 look like? What's this look like? Blah, blah, blah. And then it's tell us a little bit of the story of what your agency does and how funding would support your work, your mission. Now, we would have to make sure that it's limited so that they don't give us 25 pages
Yeah.
treatise on, but make it clear, how does funding here support the mission, the community that you serve? That's really all we'd have to change. Now, for the board, you have to still kind of vote and judge and give away however much money we have to give away. And we know that those grant dollars are going to change as other potential services come online. But the other idea is the initial setup part is when those applications come in, Raquel and I are still the ones who are like, okay, do I have all your paperwork? If it's a brand new agency, I'm probably going to do the first interview, right? So I already know that Jennifer's family support agency, we already go back. I'm like, yep, we know, we've seen her work, good. But Cindy's, what do you want to support? Health.
Drink more matcha. The benefits of matcha.
Cindy's Matcha for All agency comes forward and says, we believe that matcha as part of a nutrition education program will make everybody better. And I go, I don't know anything about this. I'm not chewing on the lawn. It was a joke we were making earlier there, Jennifer, sorry. So Raquel and I would be like, okay, we're gonna pull down your 990s, your nonprofit taxes, right? And we're gonna be like, oh, they've been around, they get other funding. Okay, we're gonna look through your website. Does this make sense? Has anybody heard of them? What's your impact? We're gonna do all that footwork, right? You're still gonna put forward your rationale, your narrative that the board will read. But if you submit stuff that we're like, all she does is serve matcha through her online sales, she doesn't actually help anyone, right? You might write a beautiful story, but if the rest is kind of bogus, we're going to bring forward to the board, like, we don't see a trust relationship with this entity at this point or for that dollar amount. So the board might say, we really love matcha and we really want to see it grow here. So we're going to make an initial investment, smaller amount than you've asked for, but we want to see you grow here, right? So it changes you can only serve matcha for 2 hours a day to tell us how it went. And that's kind of the flow of this. It's less restrictive. It takes more of a leap of faith that we're going to make these partners, but we're in the right community that we already know these folks for the most part. But it changes the philosophy of how we do grants here. And
No
so,
more books like that, Cindy, no more books. No more books like that.
What is that?
that's the grant. Oh, you didn't do the grants
That's
this
the
year.
application.
Oh my God, that's
That's
what you
right.
had to go through and that's what we go through and we grade every grant.
She's like, done.
I built 7 of these.
Here, feel free to review.
Oh my goodness.
In the process, I angered people because I used up all the papers.
She
You
took
should have
over the
seen.
copier.
It was a mess.
Yeah.
And so what that is each application comes forward with a list of, we do this, we serve this many people, we've been here this long, this is our mission.
Very redundant.
This is our program. This is who we serve. This is how many we can serve. This is what we hope to do. This is how we hope to measure what we do. Here's what we did last time.
So this has served us well to this point. I agree with you, Rachel, on much of this. I'm thinking through. So to launch this, are we assuming that our current partners that we have, which are 13
This year,
this year,
12 this year?
something like that.
Not including the MOU.
Under
Or
the
is it
Yes,
including?
no, not including the MOUs, yeah.
Okay, so would they be, are they the initial candidates of trustworthy partners?
Yes, because
Okay.
we have a knowledge
We have
and
a
a
record of
relationship
them,
already.
okay, so they will be entering into this if they choose to, as our initial graduates.
Presuming that they make the initial application.
Yeah, okay, and then would we say it's probable that we wouldn't initiate new potential folks for 1 year and test drive this thing?
I don't think so. I think that there's space for new entries. Because we can come forward fairly quickly at establishing the validity of an agency.
Okay.
I think where this might change is you might say, instead of an agency that's, in our current, they say they need this and we give them that. This agency might come in and say, we want $100,000, and the board's like, well, we don't know you.
Yeah.
So I'm gonna give you $5,000 and let's see how you do at the end of the year.
Okay.
And that's that trust piece.
So just as we've had disappointing this kind of model, telling the generalized story or the holistic story is a talent.
Mhm.
So I'm just putting that on the table, other than, it's easier to say, we did this program and we served 45 kids and the survey said that they were highly all that. So it's just a culture shift about how they tell their story so that we remain confident in the way that they use the resources we give them. So that's a whole other learning curve.
Right.
Okay.
But from the nonprofit side, and again, I'll step into having had that role, I would have told that story more often than the very narrow program story, right?
Yeah.
Because as donors come in, an individual donor, Jennifer and Cindy come in, they have $100 to donate. I tell you about what our agency does, not, well, within the confines of this program, right?
Yeah.
And if I'm gonna get your trust to invest in me, I tell you about the scope.
Yeah. Well, what, have I been through this 6 times? That 6 times?
Yeah.
Okay.
Yeah, because you and I did the first year together.
All right, so I'm okay with this, but I'm also willing to enter into a different way of doing it for all the reasons you put into this explanation paper. And, take a leap on it.
Well, and if this makes sense from this committee, what I would probably do is, for the January board meeting, and I can float this to you in advance, I'll take our current grant policy, policy, and I would revise it to reflect this format. The application part is easy. That would actually be much easier than what we have now. We could take that, present it to the board in January. With this committee's blessing, I have a feeling that'll be smooth. We'll make sure that legal test drives it as well and has no problems, which is my anticipation. We can then say, we're gonna move our grant window from February to March. And that gives me time to meet with our grantees. I always do an annual training anyway, and explain, hey, we're gonna change our model to this. Your application is going to look different. This is your opportunity to be very rich, right? Tell us what you do, the impact of your agency's efforts.
So, yes to that. So do we need a motion from the committee to make this recommendation to the board? Or a handshake?
It's mostly a handshake, but if this makes sense.
We agree.
Thank you for the trust in that. I think that the grantees are going to really, really, really embrace it. From having been from that world, It treats our grants more like we are a donor partner.
Yeah.
And that makes a big difference in involvement.
Mm-hmm.
We still will wanna do big check grant presentation, and we would still parse out money probably quarterly because financially that makes more sense for us. But they would only have to do the one report at the end of the year, which gives them plenty of time to tell the story. The financials are easy. They have to file that anyway.
Right.
So access to that is online.
Yeah. Okay. We
Thank you.
declare 3F completed.
Score.
Do you have comment for item 4?
She's like, get this book off my desk.
She's allergic to it already.
We'll take it off your hands. Yeah, and
Hopefully the
this,
application process will change.
it'll be a lot easier.
Yeah.
And this was a light year.
It was.
This was a light
We
year.
had 26 applications, 30 applications.
this year.
That we funded out of the 14 that were submitted.
Well, they're first screened by you guys, right?
No.
No,
Oh, no, like
No, no, no.
the first people.
No. Everybody who comes in, we look at things and we might say, hey, your file was corrupted, but we don't grade them. Now, I will often provide feedback like, we don't know this group, whatever, but we don't judge them. So we don't screen them. They come to you all raw dog.
yeah.
Yeah. Somebody puts the books together. So, yeah, it's
A bit of an undertaking.
All right.
and each year the board members hand us this book back and go,
Here you go.
Take it back.
and then we take everything out and we rebuild it again.
So there wouldn't, I mean, the community wouldn't have any issues with us changing quarterly to like the end of the year.
They're just glad we give the money away. You know, they are.
I'm like,
And they trust us.
Does anybody like go in and look? Can any?
They might.
Anybody
Everybody?
can.
Yeah, it's
So-
all on the web.
There was, the applications go on the website, the book is available, we have one of these books upstairs for anyone who wants to look at it. In my 6 years here, we've had one person, well, it's a pair,
It's a pair.
it was a husband and wife, who, had their opinions on what should and should not be funded.
But that was only 1 year worth. They never came back.
Right,
Oh.
and they told the board exactly what they thought.
Yes.
But so everybody has access.
Everybody has
Everybody has
access, so the applications are on the website. Currently, all of these applications from this year are on the website.
Mhm.
And then all the impact reports get put on the website, so it is absolutely out there. And the grantees understand that nothing is private. Everything they give us is public domain.
Perfect.
Yeah, that wouldn't change.
Okay,
Yeah, the story, the application, everything would still be placed on the website.
okay. I was like, I know we're limiting now the funding. So I was like, do you see anybody coming at this or being
No.
like more like, detailed in it?
I doubt it. I think as we change our funding to programs and services that no one else offers, we are doing the right thing by the community. And as long as we're doing the right thing by the community, we're spending those dollars that direction, people can disagree, they probably always will, but that is why you all are elected. If you suddenly find from your community, your zone, everybody came to you and said, I absolutely hate that you funded this, and this is why. When you come into the grading session, you're gonna say, listen, I've heard from my community, my part of the community, if you will, that they don't like this group. And Jennifer may say, you know what, I heard a couple people don't like it as well. And you're gonna discuss it, and you may decide because of that feedback that you wouldn't fund it. That's that community process. Or you may have 3 people come up and say, you guys didn't fund us last year, but you didn't understand what we did. We need to explain to you because it wasn't clear in the application. Everybody has those opportunities. That doesn't change.
We even had remember when Jessica defended her application? Mhm.
Yeah.
Yeah.
For Voices for Children,
Voices for Children.
The first year that they applied, we had a different board member who had a very different perception of how foster kids go through the system. And so she was able to make remarks about like, hey, I don't, and the board chose not to fund that year. So the second year, she changed how she wrote it in the application. She was present and she was able to answer questions. And there was 0 problems the second year. The process allows for that communication.
Okay, so I wasn't here, so they're here, like, they're able to, if we have any questions for them, they can answer them.
Not so much
Not
that,
during our conversation.
not during your conversation, because it's not really fair, because if an agency isn't there,
Yeah.
Right.
but the idea
They have
is,
to, their application is their voice.
yes.
They don't get to amend it with a lot of blah, blah.
Right. But
They
it
have to
does,
say it there.
yeah, but if they say it this year and you say, well, sorry, next year it's gonna maybe help their application.
And they can, in the in-between time, come and tell us, we weren't funded last year, but we wanted to tell you 3 things we did this year. They can advocate it that way,
Mhm.
but not during the application deliberations.
Right.
Can they come to board members and talk to them? Well, I know they, obviously.
Yeah.
But
Yeah.
what do you recommend?
So typically what happens is, throughout the whole grant process, I do a training, they can come to me and I can help them.
Mhm.
I can't explain to them how to answer the questions, right?
Yeah.
I'm like the teacher's aide. I can tell you what's gonna be on the test, I just can't tell you how to answer it.
Yeah.
Right? After the application period, I make it available to anyone who was funded or not. Come meet with me. Let me tell you what the board's feedback was. Let me tell you where there was challenges or problems. And I talk with them, and then Teresa's and Bianca, when they talk with them, we work through with these grantees the whole year if they choose to engage.
Okay.
If they choose. We had one group that applied, their application unfortunately was very weak. It didn't align with district mission. I met with them afterwards and I tried to explain that, and they said, well, we think it's important. I said, that's great, what you're doing is
Yeah,
good,
it is.
but it doesn't
But you
align
have to
with
tell
our
your-
priorities.
Yeah.
And they've never, and we said, let's work together through this next
The way
year.
the way they portrayed it, it didn't align. It could have very easily aligned.
Right.
Yeah.
So I said, let's work together in this next year so that we can see how things work. And they've never come back.
Oh, okay.
So it has to be a partnership.
Yeah.
Right? You asked for money for something that didn't fit based on your application. We had a conversation. I said, maybe it could go this way, maybe we could help that. And then there was no conversation, no follow-up.
Okay. Yeah, because I was in the fire district, I've had a lot of people.
Yeah.
Want to talk to me as a board member.
Yeah.
But I know what I can, like, there is things I couldn't say and things I couldn't.
Yeah, I mean, you
can
could
listen.
talk to
You can
anyone
listen all we want.
and you
But
could
I
say,
also recommend, like, I would totally talk to you, but I would like to have Rachel with me.
sure, yeah. Or you can say, you know what, I don't know much about that part of the grant process, talk to Rachel. Or, hey, when I read it, this was my feedback.
Yeah.
Those are all 3. What you can't say is, you know how you need to answer it?
Yeah.
It's like this.
Mhm.
Of course, then that unfairly could support one agency over another.
Yeah, I would feel more comfortable, because I'm like, I wouldn't know too much, so
Right.
like, I would love to sit in and that
Oh,
way I
absolutely.
will learn too.
Yeah.
I'll know what's going on.
Yeah, when she does the workshop, my first year, second year, I sat in on the application workshop,
Okay,
so I understood
I
how,
would like to join that.
yeah,
Yeah.
yeah.
And the idea was definitely an education like, this is the district's mission. This is what we support. If you have programming that fits with this, you need to consider applying. Understand, we're gonna ask for this metric. We're asking for you to be able to demonstrate, here's the problem, here's what you're doing about the problem, and how'd it go?
Mhm.
If you can't do that, this application's not gonna fit for you.
Mhm.
It is really that easy.
Okay.
And then there were some groups like, well, we just want to do this one thing. I'm like, okay, well, that's great, but it's about puppies and kittens and we do healthcare. I love puppies and kittens. I want to give you $1. I can't do it.
Yeah.
And that,
There's grants out there for your puppies.
there are,
Yeah, there's.
It's just not-
and I will probably give you more than $1, but I can't do it under the district. Right? So thank you for this. I think this will really help us.
Okay, so how are you gonna fold the full board in? Will we have a work study session on this? Will it be incorporated into a meeting?
It'll be incorporated into a board meeting.
Okay.
So what I'll do is I'll work on that policy. I'll work with Alex to make sure it's all good. Once I've got that that grant policy reshaped, I know we won't meet before that, so I'll just email it to you guys. You can look at it. If you see something that doesn't make sense or whatever, make a recommendation. I can edit, change it. Then we'll bring it to the full board for them to read, understand if they have questions, changes, or they may decide, I follow the strategic planning committee's recommendation that we adopt.
Okay, so that all makes sense.
Okay.
And I know it's a little bit of a fast track, but
It
that's
is.
okay, you know, get things done, move it on. So I think we're ready to launch the new way.
I'm excited.
Yeah.
Cool.
You don't wanna do that.
That is, wow.
That's why I told board members, I said, you gotta set aside at least 10 to 12 hours.
I'm like, I'm back in college.
Exactly.
Right?
Okay, so any further comments or future things that need to be brought up here? Anything from you, my friend? Okay. All right, then I guess we're adjournment time.
Awesome.
We will adjourn this committee meeting at 5:10.
Perfect.
Thank you.
Thank you.
Thank you, team, for being here and